The trial of BGJ398, I think, is a very critical one. For the past 3 decades, all that we've had is cisplatin-based chemotherapy. We recently had the approval of one PD-L1-directed antibody called Atezolizumab. But the key here is that many patients are not going to respond to immunotherapy, and ultimately all patients progress beyond chemotherapy, so we really do need some other options. BGJ398 is a targeted drug that antagonizes FGFR3. FGFR3 is a compound, or a mutation rather, that can arise in about 20% of patients with bladder cancer. And what we find is that those patients may be susceptible to drugs that target FGFR3 specifically, like BGJ398. In a series of 44 patients, we identified a response rate of 35%, which is above anything that I'm familiar with in this specific context. I would also propose that we had one complete response in the case of this study in a patient with bony metastatic disease, which I think is quite impressive as well. So as we start to think about new therapies for metastatic bladder cancer, I think we're going to have to start thinking about patients who have specific mutations and targeting those with specific drugs.